Hey guys, Dr. Alicia and Dr. Sarah here. Welcome to our labor and delivery video series. Today we are talking about postpartum expectations. So what to expect for you and your newborn in the first few days after delivery. Check out the rest of our video series. We'll link all the other videos in the show notes below. Also hit subscribe if you want to get updates on when we get new information out there. We have a website, www.shefoundhealth.ca, which has all kinds of great info, blog posts, and we're coming out with an online prenatal class, so check it out for that. Join our community on that, and you'll get all the updates weekly. Also, if you can have a look at the disclaimer at the bottom of the show notes, that would be fabulous. Anything that we mention in the show notes, we'll link down below as well.
So, postpartum and what to expect. So, generally, if you've had a vaginal birth, you'll spend about 2 days in the hospital. If you've had a cesarean section, usually on average it's about 3 days. And this time is spent resting, just being skin to skin with that new babe and establishing feeding, whether that be breastfeeding or bottle feeding. And these first few hours to days are so important for bonding and, if you are breastfeeding, for establishing your milk supply.
So a really great website we like to direct our patients to is www.firstdroplets.com. And again, I'll link that down below. It is done by a lactation consultant in the States, and she is so passionate about breastfeeding that she created this free website that talks about skin to skin, how to latch your baby, how to work on a latch if it's a bit hard, and how to express milk in those first days to hours, which is really important for getting your milk supply well established. So really great website. Check down below.
We also suggest for those early days, it's not a bad idea to limit visitors at this time. You'll be exhausted, and all those people coming in and out can be really disruptive for you for trying to rest and also spending time with your baby. There's no harm in having visitors, but if you're planning on doing that, maybe, give it a defined time to make sure that you and your partner have enough time to rest and bond with that new babe.
And just keep in mind, a lot of your time is going to be doing skin to skin and work on breastfeeding your baby, like every hour or two. And so if you have visitors coming out, if you're not really comfortable, I'm not that shy, so I probably wouldn't care, but you're going to have your breasts exposed a lot. So it's hard to really establish that latch if you're not comfortable and you have people coming in and out wanting to snuggle the baby and hold the baby. Also keeping in mind that everybody has gross germs on them, and so your baby is very vulnerable at this point, as are you. And so just being really cautious of who you invite. Save it for later. When you're home, they can come visit you, but make sure that you get them to do something useful for you when you're at home. Clean your kitchen, bring some meals, snuggle your baby while you have a shower. Useful guests are the best kind of guests.
Yeah, agree. So, like Alicia said, your baby's generally going to feed every 1 to 2 hours during those first few days to week, because what they're getting is really tiny but really powerful amounts of what we call colostrum, as well as your early milk. Their bellies are tiny, and they really need to be frequently fed during this time. You won't feel like you're producing much, but that's okay, because they don't need much at that time. They just need to feed really frequently. On average, your milk will start to come in anywhere between day 2 and day 4, and this can be super dramatic.
Whoa, boom!
Yeah. Oh,
sorry.
It can lead to significant engorgement and also leaking. So it's good to be prepared for that, to have some, good supportive bras, to have some breast pads, and, be prepared to be managing painful breasts.
Yeah, for sure. And to help deal with that leaking, because that milk in those first few days is so valuable. Often women use something called milkies. They're kind of like a milk capture device that you can put on the breast that you're not feeding out of to capture that extra milk, or something called the haka.
Oh, amazing.
And again, we'll link it down below. Or if you're finding that you're leaking and you don't have those devices, you can just press on the nipple that's leaking, and that should slow the flow down so that your baby then has the opportunity to drink that milk.
And I personally use both of those. The milk, I used to walk around with milkies on in the early days.
Nice.
And then I used a haka, so I'd feed on one side and I'd collect breast milk on the other. And like Alicia said, if you don't have them, that's okay. And if your baby's having difficulty gaining weight or you're having difficulty breastfeeding, we don't recommend using those, because we want to make sure that we're saving that milk because that's easy milk for that babe to drink.
Yeah. Or if you are using them, you can use that to top up right after the feed. So just making sure that as long as your baby is gaining weight, those are great products. If they're a little bit slow, if you're using those products, make sure you use that milk right after the feed to top them up. And that can be a really useful way of using those products.
So we mentioned babies need to eat frequently during those first few days. And, for the first couple days, it'll be literally every 1 to 2 hours. Once you get home, sometimes that spaces out, but we really recommend feeding that baby at least every 2 hours at night. Sometimes you can stretch that to as much as 3 hours. And that's from start to start. So start of a feed to the start of the next feed, we're counting that time. And we do recommend waking your baby up at night for that feeding. Sometimes you can stretch it to 4 hours, but that's something that you need to chat with your care provider about. And we generally recommend that waking baby to feed until your baby's well established in its weight gain. And oftentimes once it's above its birth weight, then we're more confident that it's got a good feeding habit established and that it's going to continue to go on and gain weight in those early weeks.
Yeah. And so we want to see you in the office to do a weight check at about 5 to 7 days after delivery. So if you're in hospital for a couple of days, you'll go home for a couple of days and then come back in to see us. And that's because we want to make sure that you're doing well, because it's a big transition, and that your baby is gaining well. So how do you know your baby's hydrated? Well, they're going to have as many P's as they are a day old. So on day 1, they should have 1 P. On day 2, they should have 2 P's, etc., etc. Up until about 5 to 7 days, they should be having 5 to 7 wet diapers a day normally. So that's how you know that your baby is getting enough milk in. And then we know because we weigh them. And so we expect babies to gain about an ounce a day, except for Sundays, I say, or 30 milliliters a day, 6 out of the 7 days. So that's kind of what we would hope for. Most babies dip down to their lowest weight at about day 5, and that's often when babies' jaundice is the worst too. And then they start to kind of gain after that. So very normal to have a dip in weight. We expect that, but we just want to make sure that weight is coming up. So day 5 to 7 is when we want to see you guys in the office. At Grow Health, we have amazing lactation consultants who work with us. And so they'll see the babies, do a weight check if they have any, and support the breastfeeding or infant feeding if you choose not to breastfeed. And then they'll grab us docs if they have any concerns. But that's how we kind of help support that early breastfeeding here at Grow Health.
So, talking about breastfeeding and infant feeding, there's so much going on in those first few weeks, and they're amazing, but they certainly can be exhausting and overwhelming. You're trying to navigate caring for this new beautiful human that you love like you've never experienced love before, and you're recovering from a super crazy intense labor and delivery experience. So what we have learned as experienced mums, between the two of us, we've got 5 kids, so we've had 5 deliveries and 5 postpartum times, is ask for help when you need it. Delegate housework and cooking and cleaning to others as much as you can. And don't stress about getting these things done. Let the laundry pile up. Let the dishes pile up. Someone else can take care of them. Most of that stuff can wait. Talk to your partner and be really explicit about what you need. And respect the same. This can be a really challenging time for partners too. And they didn't go through all the hormonal changes leading up. So it's a bit more sudden for partners. So, be sure you have open, honest conversations between the two of you to figure out what's going to work in those first few weeks at home as you adjust to, your new life as a family.
And if you're watching this video before you've had a baby, which we're assuming you are, now is a great time to start making those plans. So start making meals and putting them in the freezer, or asking your parents or friends to kind of come over and help with cleaning and cooking and that type of stuff after baby's delivered, because it's a lot of stuff, and we want you to take care of yourself and take care of your baby and take care of your family unit, including your partner. And the only way to do that is to come up with a good plan between your family unit on how to do that. Okay, so the other thing that we need to talk about, which we have tons of questions of postpartum women, is what kind of bleeding do I expect? So generally in the first couple of days, you're going to have bleeding that's like a heavy period. You'll be soaking a pad every couple of hours, so get those big postpartum pads or those Depend underwears, super useful. And that's normal. You're going to have some clots, and that's all fine as your uterus is cramping down to get back to its normal size. Then the bleeding should settle down. So I usually say it kind of does this. So it should be trending downwards. And depending on how busy your day was the day before, you might have a little bit heavier bleeding. Again, if you've been lying down for a while and you get up to go to the bathroom, you're going to have some clots most likely, and that's fine. That's just because the blood has been pooling in the back of your vagina as you were lying down. As long as that bleeding doesn't continue to be heavy afterwards, we're fine with that. So what is too heavy? Well, when you're soaking a pad every hour for 4 hours in a row, or if you have big clots and continued heavy bleeding after it. We want to know about that.
And when I say big clot, I don't mean loony or toony.
No,
we mean like sort of lime-sized clots.
Yeah.
Because the loony, toony sized clots are normal. So some women are told in the hospital to watch out for those clots. Well, that's okay, but they're normal. So it's big honkin' clots that we want to know about.
And continued bleeding afterwards. If you have a big clot and then you have no bleeding afterwards, that's usually okay.
Something else we want women to start thinking about pretty early on, maybe not the first few days, but as a physician whose first 2 children were 14 months apart, we start talking about contraception pretty early on. If you're not exclusively breastfeeding, your period can return within the first month.
Yeah.
And that means you're ovulating 2 to 3 weeks after you've had that baby.
Or even if you are exclusively breastfeeding.
Oh, yeah, same. Oh my gosh, you guys, it happens. Okay, so talk to your care providers about contraception early and often.
I had a good plan for contraception, so I was okay.
I did not. What can you do? He's a beautiful baby.
And the other option is if you know that you want an IUD after delivery, we can put those in immediately after delivery. If we don't put them in right away, we have to wait about 10 weeks. So if that is something that you know you want, a Mirena IUD, then talk to your care provider before you deliver, because we can set that up. If it's a nice, normal, safe delivery, and we can certainly put that in right away, which is a great option for some women.
Yeah, for sure. There's one more thing women often talk about or are afraid to talk about, and that is their bowels. So when you are exhausted from just having had a labor and a delivery, you're breastfeeding, you can be dehydrated and your stools can slow down. And that, combined with women who often have had a type of vaginal tear, can be really scary for women. So it's important to drink tons of fluid, and don't be hesitant to take a stool softener. The one we recommend is called PEG. It has many different...
Laxaday is what the most common one
brand name
here is, anyways. And I'll link it below in the show notes.
Yeah, but it's safe to take in breastfeeding, and it doesn't cause any dependence or anything like that. And it's just really important to keep your stools soft and flowing. You know, basically we want you to have an urge to have a bowel movement, sit down on the toilet, and be able to pass it easily without having to strain too much.
Yeah. And another tip I tell women who are a bit afraid to have that first bowel movement is to get a face cloth with some warm water and just protect your perineum. So if you've had stitches or an episiotomy, just put a little bit of pressure on your perineum. You are not going to tear anything from having a bowel movement, but it just gives people a little bit more confidence in that. So I think that about wraps it up. Thanks for watching. We hope you found it useful. If you did, please hit subscribe below. We'll link a couple of other great videos for you to watch, and then check out our show notes. Have a great day.
Thanks, guys.